shirt.
I feel like I need to get like a lasso or something.
For real.
No, it's just like talk to me. You talk to me. Don't worry about that being there.
No, but it's there. Oh,
I know. I get nervous too.
I'm like, hide it. Yeah, you're so cute. Oh my God, you are.
See, look, I'm already blushing.
Yes, you are. You're so pretty. You really, really are. So how are you doing this morning before we do all that?
I'm good.
You're good.
You know, rushed around this morning, had to get my grandkids going and my son going. My son's like, can I just stay home from school late? No.
It doesn't work that way. If only, right?
You want us to scoot over a little bit?
Oh, get in here, sister. Let's do this. There's plenty of room. Come on. We just kind of are rolling with it this morning. Literally, she's got a rolly chair.
I hope I don't fall.
All right, good morning. I'm going to steal your phone. I'm going to share this real quick so we can get this over to your audience. All right, so let me go ahead and I'm going to go into the go-to girl. How are y'all doing this morning? I want y'all to start commenting. And we are all just, I've been telling you, we rush to do these type of things, but it's so much fun. I love fly by the seat of the pants stuff. All right. Not
There we go. Like there.
oh, yes. Gosh, this is awesome. I just love it. I love it. All right. Where is this share button? You're on an iPhone. Will you share this for us? Okay. You gotta go in there and share it to the page somewhere.
She can go on her page and share it.
Yeah, share to, okay.
There you
I think it's on, okay. So, good morning. All right, so real quick, I'm going to have you, since we're all there, I've got them a little distracted.
Yeah.
Where am I at this morning?
So we're at Stratos Direct Primary Care Office off of 9th Street, right across from Sacred Heart Church and First Baptist. And we are a direct primary care office where we actually take care of little ones as well as people that are in their 90s and everybody in between. We are a membership model practice, so people actually pay a monthly fee, and we have access to them, and they have access to us 24/7. They can come in for appointments when they call for scheduling. If they are sick after our office is closed during the day, they can call us after hours and discuss things by phone or by telehealth or video visits. And yeah, that's what we do.
But membership is meaning no co-pays, none of that, right? Yeah, I just like almost interrupted you because I was like, make sure they know that.
Yeah, so we don't personally use insurance for our members because if we use insurance, there's going to be a lot of obstacles and red tape we have to go through in order to do what we need to do to take care of people. So because we're direct primary care, we don't utilize insurance for ourselves. We can use insurance if you need to have obviously surgery or something. We can write referrals for those kinds of things. We have agreements with one of the labs here that we can get cash pricing for folks, so we can get blood counts, blood tests for like $5 to $6 a piece. We also have access to x-rays and CT scans and MRIs that we can get same day for usually about 10 or 20% less than what you would pay normally for a deductible for an MRI or CAT scan. So most of the time MRIs are like $400 to $500 with a deductible. We usually can get them for about $200 with the reading on the same day.
What? Are you kidding me? So I need you guys, before we get to going like any further, because this is that's fantastic.
Yeah,
that is fantastic.
A lot of people have insurance and they just don't use it because it's too expensive to even utilize. So you have the option of either coming here and using your insurance for things you might need outside of primary care, or with us, you have the option of using no insurance and you can just basically get your labs, your x-rays, your CAT scans at a lot cheaper than your insurance would cover.
There's a lot of people that can't get insurance though.
Then those that don't have insurance that come here. And we also have people that actually, right now the big growth is in businesses. The employers cannot afford to keep their employees on a healthcare plan. So what they're doing is they're taking our services and signing up their employees, paying for their employees, which is like, $2 a day to have them on our plan. And they basically go and get a high deductible plan to cover catastrophic stuff. And that's cheaper, and they get better access than they would normally with a Blue Cross plan or an Aetna plan or whatever.
Wow, and that is so cool. I have so many small business owners that watch me too. So if you're having trouble keeping employees because there's like, I need to work somewhere that has insurance and this and that and the other, even if you can't afford to pay for their insurance, you can still mention this to them because that's kind of beating what they're going to pay at another company with insurance anyways.
Yeah,
so
95% of your care is primary care.
Yes.
We do joint injections here, we do skin lesion removals, we do regular primary care stuff when it comes to sick calls and well exams and injuries and all that. We do all that stuff here. And so most people just need a primary care doctor they can get a hold of. Right now, if you have insurance, you more likely can't get to see your doctor the same day, let alone the same week.
For months, like I hardly go to the doctor, and I know there was something I needed to go for. I can't remember what it was. And I called, and they're like, "We're no longer taking patients." A lot of doctors here are not even taking patients. Then somebody was like, "We can get you in December." I'm like, "It is literally January." This was back in January. I'm like, "What do you mean?" And unfortunately, this is a sad topic, but I used to go to Dr. Lyford, who passed away.
Yeah.
When he passed away, it was just something I needed to get refilled or something so simple, and it was literally like ridiculous. It was so ridiculous. So if you will, I want you to introduce yourself one by one, and it's Nurses Week, so we're going to put you on the spot. Yes, Happy Nurses Week. So what is your name to the public here?
My name is Dr. Jeff Swanson. I'm a family practice physician and part of the owner here at Stratos DPC.
Awesome. And you, ma'am?
And I'm Olga Kazowick. I'm also a family practice physician, and I specialize in geriatrics as well, so I have a little extra training, and I'm here.
Awesome. Awesome. That's right here at Wichita Falls. Now, we have some donuts to give away before we talk about nurse here and introduce yourself. Can you grab those donuts? I want to get people hyped up and get.
Awesome.
Oh, thank you. Now I can read some of these comments.
Okay.
Yes. So introduce yourself, and then I'm gonna have you Vanna White, the donut.
Yes.
Vanna White. So who are you?
I'm Becca, and I am the office nurse manager. So I'm the person you're going to see when you first walk in the door, or who I'm going to talk to you whenever you call our office. You're going to talk to me.
Perfect. And you are just absolutely stunning. She was a little bit nervous this morning, and now that we've got donuts in her lap, I think she's good. I'm just kidding. So I'm going to have you open these. The most nervous person, I will make them do the work.
And I'll
here.
drop the donuts.
Yes, check it out. So we're giving away a box of donuts.
Oh,
all right. So I want you guys to comment for me in the comments if you would like to win a sweet treat. So go ahead and tag your friends into this video. Heather Beck says all of our employees love Stratos DPC, which is awesome. Ronald Moses was asking where we are. So where's the address of Stratos?
Yeah, it's 1417 9th Street. So I know there's a lot of construction going on right now, but it's just off of Broad. And we sit in between basically Sacred Heart Catholic Church on the left side of us, or the west side of us, and First Baptist Church, which is on the right side of us, on the east side. So we're on 9th Street, right across.
Perfect. What were you saying, the Holy City or the Holy
Well,
Land?
yeah, we're kind of covered. We got both churches on both sides. So
Definitely. Now, I want you guys at home, I want you guys to do me a favor and hit the hearts. So I want you guys to hit the hearts so that I'll get the algorithms jumping this morning for them. So how long have you been with them?
With one of the two of them for the last little over 3.5 years.
Wow. And so this is the team.
Yes.
Is this correct?
This is the team.
Really? And so now, how can they do they get a hold of you? Do you go online and you set them up, or how does that work?
Either way, I can do it online for you. You can call and I will talk to you on the phone. You can text me. Any way you want to do it, I can do it.
You can get them set up.
Yeah, absolutely.
This is awesome. Let's talk a little bit about the pay, because this is a membership. And if you're watching this video, I want y'all to comment membership, because you can actually get a membership to come here monthly, as much as you need.
Yes.
As much as you need for your primary care. So let's talk a little bit about how they go online and how that works with you guys.
If you just go to our website, stratosdpc.com, you can click on it. It will give you can go even to the question and answer section. It pretty much answers any questions you have. If you want to become a member, just click on the link to become a member. It'll ask you your basic general information, your name, your address, your phone number. Then it'll go through your billing information, and that's it.
Perfect.
Yeah, once we get that online, then we actually send you a text with a welcome and how to schedule an appointment.
Okay, now let's talk about pricing, because everybody thinks, it's going to be an expensive membership. No, it's so affordable. It's crazy. So What is the pricing scale? Kind of like $1 for kids or something? I remember.
So when people initially register, there's an enrollment fee that everybody pays up front, and that's a one-time non-refundable fee, and that allows us to enroll you into the DPC Alliance that we have. I mentioned those prices like labs and x-rays and everything being discounted. That's part of that cost to get you into that system. So once that is paid, now you can access all those things basically at those discount prices. Then we have a monthly membership that everybody pays per month based on the age of that particular person. So if it's a family of 4, for example, and let's say you have people that have 2 parents and they're like in their 30s, and then they have 2 kids that may be like 6 years of age or something like that, it basically comes out to about $1 a day for each child, which is $30 a month for a child. So that's $60 for the 2 kids per month.
Okay.
And then the parents, they're going to be roughly around $2 a day. So that's $60 a piece for them. So it's $120 for the parents and $60 for the 2 kids. So what is that? $180 a month. So $180 a month, you actually get access to us. You can call us after hours if you need to. We can do health call, phone calls, telephone visits, video. And you can come in for an appointment. If your kid has an ear infection, you can call us and we can get you in the same day or take care of it over the phone. You don't have to wait for your doctor to call you back 2 days later or have to go to the ER and spend $3,000.
And you know, and I want to mention to people that that's for a family of 4, though.
Right.
Like if you're just an individual or somebody like that too. I mean,
it's less than $100 per person. Per month.
Per month, yeah. So I mean, that's incredibly affordable. And so I want to open this up. Is there a senior citizen discount? Margie wants to know, how does it work for senior citizens?
Yeah, so senior citizens, we actually have in the system already in place all the discounts that are available for people that have families and so forth. So the more people that sign up, that enrollment fee we talked about gets cheaper.
Okay.
So instead of being $80 a person, if you have a family of 3, 4, 5, 6, 7, or 8, it's just $225 flat fee. You don't pay each member $80. You just pay $225, and everybody can sign in.
Yeah, they can all split that.
Correct. And then they just pay their monthly fee, like I mentioned before, $1 a day, $2 a day, $3 a day, depending on what they need. For some of our folks that are seniors, a lot of them don't travel or they can't travel very often, so we actually allow them to do a house call. We'll basically go out to their house and do a visit there, and they usually pay about $4 a day for us to do that.
Wow, that is awesome. Now, do you see a lot of people from those surrounding areas, like Burnett and I mean, so you have patients all in this?
We have patients as far as Presho, South Dakota.
Really?
Which is basically in the middle of nowhere.
Do they just call you because they can do the telehealth type thing?
Right.
Yeah, they basically would call and they'll say, listen, I have this concern or whatever, and we'll take care of it by a video visit. And in fact, we had one gentleman that we ended up getting him into surgery for an aneurysm that he had repaired by phone, 1,000 miles away, that we were able to do for him. And he otherwise wouldn't have had care. He would have been waiting until he had a problem with his aneurysm and had to go to the ER. So we were able to coordinate that.
That is crazy.
We've had people actually call us and they say, hey, listen, Dr. Swanson, I just got on vacation. I went to Colorado and I forgot all my medicines at home. And they call us and I'll say, okay, where are you? And they'll give me the name of the place, like, what's your closest pharmacy? And they'll say whatever it was, and I'll just say, okay, 5 minutes later, they got all their medicines ready to go at the pharmacy to pick up. So they don't have to worry about, I left my medicines, how do I get home my doctor? You have our cell number. You have our personal cell phone that you can call us on if you need something.
And you don't have to Google stuff. I'm gonna mention this. So guys, I want your feedback on this. I was talking to them about, in the near future, doing a weekly episode where you can actually comment and ask questions, like primary care type questions, like, you know, oh, I've got, well, maybe not saying you have a rash, but what would you do if I have a rash? But, you know, normal questions like acne, you know, different things that, because people Google, like, oh, I've been having this bad cough for days. I think I have a hernia. I'm not going to make fun of myself on Facebook Live. No. But, you know, stuff like that, to where I think that would be, they're hitting the hearts. They definitely are. Yes. Okay, I want to know from our viewers at home, have you ever Googled something and it almost scared you to death? Have you ever? Let's see if we get any comments on this. It's Friday morning. People are sleeping in. Where are y'all at this morning? I usually haven't. So I want to know the feedback on that. I want to know. I'm going to give y'all a second here to comment that. Now, again, we're at Stratos DPC. And Danielle says yes. Yes. And did you think you were dying? I'm telling you. So it's absolutely crazy how that works. Yes, everybody's commenting yes. Everybody, I mean, it's so funny how that works. What are some oddball things that, trying to think of medical things that you thought, oh my God, I'm dying, but there's nobody to call. Have you been in that situation? Like, I am dying, it's late at night. I want to know your feedback, like, because I've been there. I've been there with my kids with fever and stuff like that. Nobody to talk me through it.
It's sore throat, it's cough, it's abdominal pain, it hurts to pee. It could be rashes that have developed on a kid.
Yeah.
We don't see chicken pox as often, but things like shingles comes up quite often. Hey doc, I got this burning pain on my arm. There's like a rash, and I'm like, well, send me a pic. And they'll send me a picture. I'm like, it's shingles. Here's the valcyclovir. Call it in the pharmacy.
Yeah.
So those kind of things will come up quite often after hours.
That is great. Yeah.
And I think people Google things because they don't really have that relationship with their doctor, So
Yeah.
that's one of the things that we have here. We know everybody who signs up, and so they feel comfortable enough, being able to ask us questions instead of having to go to Google, like you said.
Well, we
That's good.
have patients that we took care of before at our previous practice that sometimes will call or have the pharmacy call for refills on medicine, and in 2 seconds we all look at them anyways. They're not a member. We know pretty quickly that they actually aren't our patient because we know all our patients.
Yeah.
We know every one of them.
Yeah. Margie says, yep, even being a retired nurse, some things shock and scare me. Exactly. I mean, it's so crazy because it could be late at night or something that comes up. So how long have you guys been doing this?
Well, we started our opener practice here in January of this year. We've been practicing medicine for 25 years.
Yeah.
So it's been a while.
So awesome.
Yeah.
This is awesome.
99.
Yes. So now they are on Facebook too. You can follow them on Facebook, and you can go to the website. You can go to their website to get more information on how to join their membership. What I want from you guys, I want you guys to tag a few people in here, and I want to know the types of things that if we do a weekly show that you would want to know about. So because I think it would be so cool to take these two and her and make a little, ask the doctors.
Yeah.
It's cool because with technology, I kind of have the ability to do that. I can create a show out of them. So I want to know, do you guys, what kind of things would you like to be able to ask once a week? You can't ask them everything. You have to ask it in comments or whatnot. But then, build that relationship with you.
Yeah, no personal videos
Absolutely.
or pictures.
Don't send those. Yes, and there'll be a disclaimer saying if you give that's up to you, but no pictures and stuff like that. So, guys, I am so excited to be here. I think we need to give away these donuts here in a minute. Oh, I'm trying to look at the time to make sure we're
7:49. Yeah.
Oh, we got a little bit more time. So,
we can do a tour. We just finished.
let's do it.
Oh, yeah.
Let's do it.
Oh,
Yes. All right, we're gonna take a tour. Can y'all hit the hearts, please? All right. Let's set your phone down,
There you go.
my dear. Let me grab this bad boy out of here.
I'm setting the donuts down.
Yeah, don't
And
sit
let's
on-
start. Hey, let's start outside so they can see the street of where. Turn it around out of my chin. I'm literally zoomed into my chin. Wait, I still have to show these off again. These are. I just love them. I love them. All right, so we're behind the
And
scenes
look
here.
at this. These are our QR codes. If you want to just put them on there, maybe for a little bit.
How cool is
So
this?
you can go straight to our website and our Facebook page and our Instagram account.
I love it. Look, you're tech savvy too. Yes, you're on there. Making it all simple, and I love this. To me is like a kind of like a California style or like a chic. I don't know. I just love it. I love even the building. The building outside is a really cool little building. It's so pretty. All right, so guys.
People come in to get their own parking spot up front, so they have the Stratos member parking only, and then we have one for actually people that have handicap abilities. They'll have a Stratos parking lot. We have extra parking lot on the side and in the back.
Okay, so that's your parking lot too.
No, this actually is part of the Catholic Charities.
Oh.
but sometimes people will miss our parking lot and park over there. But we do have parking in the back for them.
Okay,
as well.
perfect,
Yeah,
perfect.
people right in front of the building.
Yeah, and the numbers are right there. So, I mean, you can't miss the numbers.
Sacred Heart Church is there, and First Baptist is over there. So, and
Perfect.
there's a park in front of us. So
Yes,
never
look
miss
at the park. I love it. And it's so pretty out. Oh my gosh, it's such a pretty day, guys.
Gorgeous.
All right, so we are here at Stratos this morning, and I'm excited. I just love this. It smells good in here too. It
Everyone
does.
always says that.
It does. Why do you like? Is it a secret?
I can't tell. I don't know. It's
It smells so good. All right.
And now
So-
we're doing
some special fragrance.
Yeah, so I'm gonna let you lead the tour.
So this is our, like I said, our waiting room. Typically people don't wait very long. They go straight into nurses Becca's room. And this is where we get your vitals, your weight, and we put it all into system.
And you're the one, the go-to woman. You're the go-to woman, and your name is Becca.
Yes.
Is that okay? So you
Yes.
can see Becca in her.
Yes.
All right. Good morning, Hastings Restoration. Hello, Brian Hastings. All right. So
All right.
tell me a little more. Have you walk me?
So this is just a hallway. We got 2 bathrooms here on the right. We have my exam room here on the right in front of you. Nice and
Perfect.
comfortable. We see our patients in the same room as we do the exam. So
Okay.
that's kind of a little bit of a change from what we were typically doing in the past. Kind of fun.
It is. I mean, I love it. It's cute. I like your skeleton guy.
Oh, thank you.
Yeah, I do. I'm gonna get up close and press. Look at that picture. Aww. Y'all are so cute. Y'all really are. All right.
All right. So let's keep going.
She's like, let's moving along. Go to girl. She's like, you're zooming in on our pictures.
Yeah.
These are. I still love these too. I think even the boiler is
That's a family that actually makes those down near somewhere near Waco. They made them for us, and they actually are relatively inexpensive metal. They actually pick your font, and they will pick your size, and they will send it here within a couple of days. Really nice.
love it. Love it.
Yeah, and this is our procedure room. And this is where we
Perfect.
do injections, joint injections, skin procedures.
Irrigation.
Let's talk about some of that. Oh, irrigation. I actually, I'm fine talking about my personal business on Facebook. So one time I had my ears were stopped up and they had to like flush them with water.
Yeah.
So that was pain. Like having that ear problem hit me. Like all of a sudden one day it hurt so bad. So what are some of the procedures that you do? Like, because that's pretty intense.
Yeah, I mean, most of these procedures that we do are things that you do in most primary care offices. We do like irrigation, skin lesion removal for things that are like abnormal moles, even some skin cancers we'll remove here in the office, depending on what type and where they are. Some of them, obviously, if they're around like the eyes or nose or those kind of places, we might have to send you to dermatology. But for most things we do here in the office, skin tags we remove. We do joint injections, like you said, tendon injections. If you have tendonitis, we can do injections for those. Toenail removal.
Ooh.
If you have a problem with ingrown nail, we can do that. So for the most part, all the foot care, cryotherapy, which is that freezing stuff that people know about, freeze off lesions, we can do that here as well. EKGs we do for their heart, and pretty much all the wound care you can think of. If someone has a laceration, they cut their finger, they can come in here and we can stitch them up, as opposed to going to the ER. We have tetanus boosters, we get new tetanus shots. So we do pretty much everything in primary care office we normally do. Mm-hmm. Nowadays, with primary care, though, most primary care docs don't have time, so they'll refer you for all these types of things, or for things like even lacerations. I don't have time to go to the walk-in clinic. I don't have time to go to
They don't. I mean, people are busier than ever. So the joint injections, what does that do, or what is that?
Joint injection, typically we'll put in a couple of medications into the point where they're hurting the most. And typically for people who have arthritis, that's, the people we will inject. We'll use a steroid and 2 types of pain medications. And typically it's like taking an aspirin, but instead of doing that, we're putting it straight into the joint.
Oh my God. I've always heard people saying I need to go get a shot in my whatever.
Yeah, it's not, I mean, you don't do it on every patient with joint pain, but depending on the patients you have, they've tried therapies and Motrins and stuff and it's not working, or if they can't take it because it hurts their stomach, we'll say, well, let's just put the medicine into the joint space. So they usually come in hobbling and then they walk out with no pain. And so it's really nice to see that kind of improve it that quickly, but that's what that's.
Oh, I'm all excited. Now, Darlene is wanting to know, do they take all kinds of insurance? So let's talk a little bit, because now I have new people hopping on, and let's talk about how your clinic works.
Sure. So we're a monthly membership. We don't use insurance for our practice. People basically pay a membership price, anywhere between $60 a month up to maybe $9 a month, depending on their need and also their age. And you can go on our website and take a look at that. We don't personally use your insurance for anything that we do. If we need to use your insurance for things like surgery or whatever, we can write referrals for those types of things. We write prescriptions for medications and that kind of stuff. But anything we do in our office is typically something that's covered with our membership. There's things like we do, like for example on the injection. I can't create Kenalog or steroid, so we buy the Kenalog and then we basically give it to patients for their needs. For example, we just charge them what it costs us for the Kenalog. So we don't charge, for a joint injection. If you go to a specialist, they might charge you $300 or $400. We usually charge for a Kenalog shot somewhere between $10 and $20 a shot, depending on the dose that we use.
Wow.
So we do this at cost, because the idea of this whole system is to give people access to us and make it affordable. The idea here is not to make it so we're charging what other places like big hospitals charge or specialists may charge with insurance. They're billing huge pricing for insurances, trying to get back as much money as they can. We're trying to make this an easier experience, but also a less expensive experience.
Yeah.
Wow.
And also, because we don't take insurance, we don't have to pay copays. So people can come in and obviously that's a huge benefit, because typically when you go into a doctor's office, you have to pay, usually $50 or above. So,
I mean, it's crazy because, if you come to the doctor twice here a month, you've already profited.
Right.
That's absolutely, and there's a lot of people that need to be able to come to the doctor as much as they want to without worrying, oh God, another copay. Oh God, another, yeah.
People don't necessarily realize how much they would utilize a doctor if they had this kind of access. We have people come in and say, oh, well, I'll probably never use you, but I guess I'll get it anyway. And then within 3 or 4 days, they've called 3 times because they had a problem that came up. They just didn't know they could access us that easily.
Yeah.
And so they're like, we had one lady in particular, she had called us and said, listen, I think my kid has maybe strep throat, and they're complaining, and they woke this morning with throat pain and have a fever. I was like, all right, well, bring them over to the office, take a look at them. She goes, like now? I was like, right now. I'll meet you here in 15 minutes. So she had her here in 15 minutes. We take a look. It's strep. Gave her the antibiotic, on their way. And that didn't cost her anything more other than just buying the $3 antibiotic. Other than that,
exactly.
Done.
Yeah.
One thing I want to mention too is there's no point for you to try to upsell people. You're not like, oh, you need to come back for this. Now you need to do this. Now you got to do that. There's no point to just, you're a membership, they're paying regardless. So there's no point to sell them on coming in 20 times in a month. Because I think that's the biggest thing for somebody that's busy like me. You can go, and I don't go to the doctor very often, but I know the times that I have is they're like, okay, we'll see you for this, but then we need a follow up for that. And then you got to fill this out, and then we're going to get you into the wellness for the women's stuff. And before you know it, you got 5 appointments, and you're like, I can't be off work like that.
We figured out that if we can save someone one or even one emergency room visit, or maybe 2 urgent care visits, that's paid for the membership for the year.
For the full year.
For the full year.
Yeah.
Because if you think about what these things cost, if you go to urgent care, it's $300 usually to go in there. And you could do 2 of those, that's $600. And most of our memberships are usually between $600 and $700 a year. So you've already paid for that just for those 2 evaluations. And that doesn't include your physical, it's included. It's
crazy.
Or anything else. If you go to the ER one time, that's like 2.5 years of membership for us.
Yeah.
That's awesome.
That's crazy.
Well, I tell you what, Darlene wants the website. So here after this video, I'm going to have you, gorgeous,
Hey.
type in that. Yes. And so we're going to wrap this tour up because I've got to go to work. I'm so sad. I know. You've got to go to work. I've got to go to work. Which I love my job, just in case you're watching Cheryl Botkin. Hey, girl, hey, I'm ready to do some insurance. All right, hold on, let me turn this around. All right, so this is fantastic. I love it, love it, love it. Love it.
That's what you're
I do. All right, so I want your feedback though. Who thinks we should do a weekly topic? I think that would be a lot of fun, and then open it up to questions at the end. I love it. This is where you are, right?
This is my board that I do all my education on right here.
There you go.
I have a board I can talk to them about what they had going on.
Oh, you even draw pictures and stuff?
I'm
Like,
like Picasso. But
yes. Oh my God. Do you do stick people? That like, here's your leg and this is the bone. I'm just kidding. Somebody is commenting. Let's see who that was. Who is that? Stephanie Lee Bohannon just commented with the website for you.
Thank you, Stephanie.
Isn't that? I tell you what, I have the coolest viewers, and I just love it. I love it, and you've got cool people too. Yeah. All right, so guys, we're wrapping this up. Let us know. I want to know in your feedback what type of topics you would like to know more about, and if you want to ask questions, go ahead and put not necessarily health related questions, but how to get set up with them, or this, that, and the other. Go ahead and put those in the comments as well. So I'm gonna kind of get y'all grouped up here real quick, because I'm gonna these are the faces of Stratos DPC. You can find them here in Wichita Falls. All right, and anything you guys want to add to this video?
You have to give our donuts away.
Oh my God, yes, donuts. All right, who wants the donuts? Somebody comment.
Because if not, I'm going to have to eat these.
What time are y'all here? Because I know it's before you open. What time will y'all be
normally
here?
Our office hours are here 9 o'clock in the morning, and we usually go until 4 o'clock. But again, people have access to us, anytime afterwards they need to.
All right, so somebody can come and get these after 9 this morning. Let's pick someone. All right. Darlene, I'm picking you, girlfriend. Are you going to come get you these donuts? All right.
They don't come by 12, they'll probably gone.
Do you hear him? He's like, all right. So, Darlene, I'm giving you a few seconds to comment. Are you still here, Darlene? Are you here? Do you want the donuts?
The donuts.
Because
come on.
I'm telling you, he said he would eat them.
I have no problem.
Yes!
Easter is already over, so I can eat whatever I want now.
Darlene says I'll be there before 4. Okay, well, I guess, Darlene. All right. Love you guys. Thank you so much for watching. Be sure to stay tuned. I have so much cool stuff coming up. You have no idea. I'm really, really excited about all the neat things that are going on with Go-To-Girl. So be sure to share this video and support local. If you just love the fact that you can ask them questions and they have this really cool membership and stuff. Help us get this out there, because there are tons of people right here in Wichita Falls that need them. Darlene said, let them eat them. No, Darlene, it doesn't work that way. It does not work that way. Okay.
3 of
So,
us do not eat a dozen donuts.
Darlene, pick someone else in the comments, like Margie or someone. You pick someone. She goes for what they do. Aww. All right.
Thanks, Darlene.
So, watch later. We're gonna get selfies. I'm gonna get a selfie of you eating a donut. Like, seriously. All right. Well, they're gonna eat the donuts. They're gonna send us pictures of eating the donuts.
Sure.
Let's do that. Let's do that.
Before and after.
Yes, before and after. All right. And Hastings, she tagged Hastings Restoration. So I want you to grab a few. Brian Hastings is awesome. So, all right. I'm getting off here. Hastings Restoration. Come up here. Meet them. I'm like throwing peace signs. I feel like I'm like, hey, oh, look at her! I love them. I love them.
She's
Give
being
me
a queen, by the way.
give me a peace sign here. All right, we're gonna hop off, guys. Thanks so much for all you do, and I will talk to you later. Smooches.